Thanks. Hello, everyone. I'm Janice Bowie, and I am one of the leaders of Q, Consumers United for Evidence-Based Healthcare. And we're delighted to have you join us for our first of several webinars that we hope to be focusing on this issue of engagement of consumers in healthcare, as well as really looking closely at this issue of health equity and how it is impacted by the many ways in which health and healthcare is delivered and perceived. So today we are kicking off our series with two dynamic presenters. And they will be addressing the topic that is in front of you on the screen. So I don't need to read that, but I just want to tell you a little bit about these two individuals who I've had the pleasure of working with. The first that's on my screen below me is Dr. Sherrie Wallington. And I've had the pleasure of working with Sherrie over a few years, but someone who I feel like I've known all my life. Sherrie is an assistant professor at GW, George Washington University, in the School of Nursing. And Sherrie has also been serving in the capacity of being on our advisory committee for Q. I also work with her in the Center for Health Disparity Solutions. And Sherrie is really known for her compassion and care, particularly among underrepresented communities and communities that have been historically disadvantaged. Most of her research, as well as her practice, has focused on health communications. And so I'm delighted to have her join us today. And then she is also participating along with our co-chair of our steering committee for Q, Bill Vaughan. It says William Vaughan, but we all call him Bill. I sometimes say, don't mess with Bill if you're old enough to remember that song. But Bill has been involved for many years, really in consumer advocacy and public policy making. He, in addition to his work with Q, has been an advisor on the National Committee to Preserve Social Security and Medicare, something that is important to all of us as we move across this life course. So I won't take any more time. We're going to start first with Bill, and then follow with Sherrie. And you can put your questions in the chat. We also will have some discussion in breakout rooms. So I'll turn it back over to you, Jeannie, and look forward to hearing from our speakers today.
Thank you so much for the introduction, Janice. Bill, whenever you are ready.
Thank you, everybody, very much. You see our handles down in the right-hand corner of the screen, if on Twitter and so forth. But I just want to state I have no conflicts of interest on any of these topics. And Q has, well, Janice has already described what it does, tries to promote use of good science in the healthcare of patients, and to provide sources of information to people like the Cochrane Collaboration Library and AHRQ, and let people know where they can go to find good, sound scientific information, and how to read clinical trial results and where they can get results in plain language. So that's our goal, about 44 organizations, and we hope to grow. Anybody interested in joining, knock on the door. We're welcome to have new folks. Science clearly under attack, as seen by the last 12 months. I've got a bunch of quotes here, too many to read maybe, but I like the middle one, where when I was a kid, you got your vaccine. It was like brushing your teeth. Of course you did. And today it's this huge drama and agony that the country's going through. And it feels like this must be what it was like in Tennessee 96 years ago during the Scopes monkey trial. And after 100 years almost, the poor monkeys are still losing. I mean, we are not winning this battle for science like I would have thought was going to happen. And why has it happened? That's way beyond the 15 minutes that I have. Again, some long quotes from some experts. What's going on is a real trouble with systems and belief in government and trust in systems that is beyond Q's power to fix. Science certainly is part of the problem in that that Tuskegee experiment is a deep scar in the minority communities of this country. The performance of government leaders and even some of the health people in the last year has sown confusion. It's more on why. Again, I can forward these slides to anybody interested. I like the middle quote. It is not about facts. It's faith, trust, and values trump scientific rationale for those whose sentiments and beliefs are deep. And this is another good quote. The first line from Dr. Berman's recent book, people change their own minds. We can't do it for them, but we can sure try. And because that anti-science movement hurts us all. By slowing the day we get to herd immunity, well, heck, threatens my life, my family's life. Health costs increase, taxes, deficits. It's one thing to say, I'm not going to take a shot. Some people shouldn't take a shot. It's another thing to be out there actively encouraging large numbers of people not to take shots. And how do we deal with that? I like the new president's proposal to include a science spot in the cabinet. MIT and Harvard professor or leader Eric Lander filling that spot. And one of the 5 goals that they've been given is to improve support and understanding of science among the American people. But how exactly will he do that? And we could talk about that a little bit later. We certainly can't force people to science. Horses forced to water don't always drink, and then increases their resistance. Education, well, of course. Here's a neat quote from the editor of Lancet magazine, Lancet Medical Journal, this summer. And that's pretty obvious. We don't, and as we deal with people, we don't call them crazy or nutty or despicable or any other epithet. But, oh, Lordy, education is very slow process. It's retail politics is knocking door to door without any TV ads. Education is very, very slow. Think of it that for as long as I can remember, Medicare has been yapping about seniors should get the flu shot every fall, year after year. And year after year, 30% of us, people my age, do not get the shot. And it's just a sign of how difficult education can be. So the goal of my little talk today is how could we speed adoption of good science in healthcare, and organizations or individuals like each of us can increase policy making engagement activities to endorse the use of good science in healthcare. It's a new year, a new page, a new administration, and they may be open for some new ideas. And most of the Q groups, I'd say almost all of them, except maybe mine, are not organized to be lobbyists, and lobbying isn't something that we do. And I'm not talking about lobbying. This isn't lobbying, but it is presenting some ideas in op-eds or in, if you ever get on talk radio or whatever, to spread the ideas of new ways of thinking about science. Why? Good science in healthcare can save money. And folks, to copy the new president, folks, in the hour that we have together, the national debt on our children and grandchildren and great-grandchildren will go up about $400 million. That's $100,000 of new debt, not spending, debt per second. Think of that. People want to improve and expand Medicare. Forget that. Just keeping the Medicare Part A trust fund so that it can pay all of its bills is going to take about $800 billion in new savings or new taxes in the next decade. So the federal government desperately needs money. And if we can make the case that evidence-based healthcare can help people with the nation's financial woes, we can get their attention. People will listen to us because they desperately need the money. Some ideas, just ideas to throw out there for discussion, breakout groups and so forth. Why not reward people for using good science in healthcare? Former Congressman Delaney, who ran for president a while last year, had an op-ed in the Post 3-4 weeks ago. Instead of just general stimulus money, help reimburse people who get the shot for the time lost from work, for the inconvenience, for the hassle of transportation. That would be particularly important for lower income folks and minority communities who are not getting the shot at the same ratio as the white community. We need to incentivize these people to get inoculated. Delaney talked about some case studies in India that helped encourage inoculation. Dollar General has, the chain of stores has announced that they're going to pay their people to get a shot. An idea to think about. Preventive care. What if we said to the Medicare population who has to pay $148.50 a month for their Part B Medicare premiums, hey guys, you could get a discount on that premium if you keep your preventive benefits up to date. You get your pneumonia shots, your flu shots, your shingles shots. Help encourage people by rewarding them for good preventive care. Just an idea. I hope personally that there'll be a bipartisan, nonpartisan National Commission on how we got so goofed up in the COVID-19 year. And one of the things that we need is better health literacy and education in this country so people understand how and why it takes a while to develop a vaccine and what the proof is that a vaccine is good, that they understand what the trial process is. And that's an idea that we could spread with the new science cabinet secretary, that he make that part of his portfolio. Healthy People 2030, which sets out the goals over a decade for what America should be doing, has some sections on personal health literacy and the need to improve organizational health literacy, but it's very vague. There's no real details. We as Q groups could be offering some specific ideas to help with that education. 60 million people on Medicare. Every time they get a bill, they get a statement from Medicare. Younger ones might be doing it electronically, but I get the old kind like this in an envelope. And every month I pay my Part B premium, I get a receipt, an envelope. Those envelopes are unused. There's nothing on the back of them. There's nothing that says, hey, you want to find out what's the latest in medical research? A good source is AHRQ. A good source is the Cochrane collaboration. Every month, millions of people are getting these mailings, and we're missing the chance to educate. That's the kind of thing we should be talking about. We should encourage the use of the choosing wisely procedures This is a list of over 400 procedures that the nation's 70 medical specialty societies have identified as pretty useless procedures. They don't do anything, they don't do any good. They just take up money. They waste your time. And while all of these recommendations have been made, tens of thousands of doctors don't pay any attention to them. They keep doing these same old wasteful things. Why don't we encourage Medicare and Medicaid to say, guys, if it's on the do not do list of the Choosing Wisely program, of course there'd be exceptions. Of course, sometimes you need something that's on that list. But in general, we're not going to pay for that stuff because it's just garbage. It's a waste of money. And clean up the misinformation on the internet. There's so many studies that show the stuff you see on most YouTube sites and throughout the internet is incomplete, inaccurate, or just advertising. Sometimes pretty shoddy advertising. Medical groups come to Q and say, hey, we'd like a patient representative, a consumer representative to help with our practice guideline development. And we should say to them, yeah, happy to, guys. That's what we do. But we want you to post on your website in plain English language what those practice guidelines are in a language that any ordinary person with an 8th grade education could understand. That's the kind of thing Q folks could be advocating. So enough of a few ideas. I hope during the breakout there'd be some reactions, other ideas, and what our next steps might be. So let me stop there and thank you all for staying tuned.
Great. Thank you so much, Bill. That was such an invigorating presentation. We really appreciate it. We will save questions and comments for the breakout rooms, but if there is something that you would like to put in the chat window, please feel free to. And then next up is Dr. Sherrie Wallington, who will present next. And following Dr. Wallington's presentation, we will have about 20 minutes in breakout rooms just to discuss these presentations, your own experiences, and your ideas. We would love to hear from you. So Sherrie, I will let you take it away. Oh, you are Sherrie.
You can hear me okay?
Perfect.
Great. Okay, thank you. Good afternoon, everyone, and thank you for joining us. And I want to thank Bill for giving us such great background and information to move forward and just really think about ideas and discussion. And let's see. Okay, and let me just go back. I have no conflict of interest for this presentation. And in building off of Bill's discussion, I really want us to take a moment to really think about science communication and really what it is. And it's really the practice of communicating scientific content to non-experts, policymakers, media, and the general public, just like all of us, consumers too. So Bill talked about literacy, and that's one thing that certainly, as Janice has said, my area is health communication, and I've focused really a lot on cancer and cancer communication and cancer disparities. But one thing that we often fail to remember or we often overlook, and that is that science and literacy are so important. And when we think about the problems that we're seeing with science communication, literacy isn't the sole issue because we know that the challenges that we face are multi-level and they're multi-dimensional, and they stem from a lot of historical situations and events. But some of the greatest challenges we face today have scientific or technological components. For example, disparities in mortality rates, access to education, and certainly COVID-19 and other health conditions, climate change, sustainable development, genetic modification, an aging population. One of the things I recently was focusing on was age disparities, privacy, security, dwindling resources, and cyber warfare. And these are all what I call wicked problems. They're multidimensional, they're multi-level, and they need many different sectors, all of us working together to come up with creative solutions. However, there is a disparity in understanding how science figures into these issues. Understanding the complexities of these problems requires some degree of scientific literacy. So we're basically losing the public space in science. There have been a lot of research over the years, surveys, and some more recently, nationally and globally, that have proclaimed the loss of the public faith in science. Misinformation epidemic, science literacy, science information competition causes an information back and forth dynamic. And this leads to mistakes, errors, fake news, and public trust. And I love this cartoon because it really captures the way many of us are seeing. You know, there's so much news out there. We have a 24/7 news information industry, and the landscape is just flooded with science, communication, news, some good and so bad. And so many people are saying, stop, enough is enough. So this is the Pew Research Center is an organization that really does a lot of great surveys. And in the recent 2019 survey, Americans' Confidence in Science and Scientists survey, some of their findings were very interesting. Hesitancy of emerging science often tied to concern for loss of human control and conflict with personal values. 73% of the US adults perceive net benefits from science for society. 80% of US adults perceive scientists to act in the public interest, and that's good because that was up from their survey in 2016. Scientific integrity is widespread, higher trust in medical practitioners, and 57% report more trust in research findings when data is openly available. I think that's an important finding. And 58% report less trust if funded by industry group. And so that's one survey, but there are other surveys that also support the fact that people are losing their trust in science. And what can we do to get back? Let's see. And so one of the things is that we have to focus on is that we need to find the balance in science communication. I think that our industry, those of us in science and research, you know, we often think that it sounds like a cliche, but if we build it, the public will come. And I think that we're seeing that that's not necessarily true, and that we have a responsibility in science to our consumers, to our community, to make sure that one, the science is accurate, is clear, and that we take responsibility and we say when things are not clear, when things are not right, and when things are have problems, and we need to be transparent. So what a lot of the research suggests is that good science communication needs to engage the public. Scientists and the public have different communication styles. And while scientists often start by placing research in a historical context, the public wants to know the key point at the start. You know, how does this affect me? What's the so what? What does this mean for me? So from the researcher standpoint, we're focusing on typically background, supporting details, results, and the conclusions. But somehow when we are communicating this, we forget the public. What's the bottom line? What's the so what? And then the supporting details. All very important when we're communicating to the public. Okay, so now I want to talk about how do we create inclusive science communication through a framing lens. So we have all of this wonderful science, but what does that mean in terms of inclusivity, making sure that we have an equity frame? We can ask communicators to better understand the ways in which their framing is connected to historical practices that have targeted and harmed marginalized communities and continue to do so in part through current scientific discourse. Communicators should become aware of their own positionality and partial perspectives. And we should name sources of inequity. We should call those things that are inequitable out that arise from the uneven power relations. So some of the principles of good science communication are assemble a diverse and interdisciplinary team. Many times we work in silos, but it's that coming together as interdisciplinary teams that we can find good solutions. And tell a story. How can you take some of the most important scientific discoveries today? So now we're talking about the COVID vaccines. So how can we take this scientific information and tell a clear story about these vaccines and make the message personal? Communicate with people, not at them. Remember to be human first. I want to say that again. Remember to be human first. Established a role as a trusted partner. So there are so many panels, there are so many conversations, there's so much research on what can we do to get the public or communities, especially communities of color, to trust us. But first, before you can ask people to trust you, you have to understand how trust is broken. And for many organizations, we have not always done those things to build trust. And so first, we have to become a trusted partner. Make messaging, health literacy, linguistic, and culturally appropriate. And then when thinking about metrics, we can talk about communication goals, observable and measurable goals like immunization rates, improved health and scientific literacy, goals with less predictable outcomes like knowledge, attitudes, informed decision making. And then we also should focus on staffing and interaction. Are the right people involved? Are they communicating effectively between themselves? Are they communicating effectively externally, media, policymakers? And then what are the process steps? Listening. Ooh, I have to say that again. Listening, using qualitative research, process and understand, respond, provide information relevant to the audience, and always be transparent and honest. And the thing about what we're seeing with the COVID situation is things are changing so rapidly and quickly that it's hard for even the scientists, it's hard for the medical community, it's hard for states and municipalities, and even for the public to keep up. But as we communicate about this, it's okay to say we don't know everything. And I think the public really appreciates when we do say we don't know everything, but here's what we're doing to find out. Okay. And then let's see, was that my last thing? Yeah. The good metrics. Okay. And then here are some wonderful resources that I've been reading, and I wanted to share them with you. One is called Publicity or Perish, Finding the Balance in Science Communication by Simon Donner. Another great read, opinion piece, lay summaries needed to enhance science communication. And then Science Audiences, Misinformation and Fake News. And then Situating the Scientists, Creating inclusive science communication through equity framing, and environmental justice. So I'm going to stop there and thank you so much. And today, I hope that what Bill and I have shared have given you more things to think about, great ideas. And now I'll turn it back over to Janice and Jeannie.